it's not just when we do.
That was my bald spot.
Mine too.
Well, if people talk
I
around,
was at the end of the pile.
Yeah, right.
it's voice.
I don't know how to do
I don't know.
What I do for HHL is I use a computer.
Or you could just swing it.
Computers back there.
Thank you for that knowledge.
Yeah.
Sorry for my learning curve here this morning or afternoon. See, I don't even know what time of day it is. Okay, Mark, thank you for your patience.
And everything.
It's working, it's recording.
Okay, I'd like to call the meeting to order. It's 1:00. This is the ADRC meeting. Approval of the minutes from the previous meeting.
I make a motion to approve minutes of our previous.
Okay, we've got a motion. Is there a second?
I'll second them.
Motion is seconded. Any further discussion? All in favor, say aye.
Aye.
Opposed? Motion carries. The minutes are approved. Would comment? I don't see anyone besides the board here. Human Services,
Morning, everybody.
you can sit up at the table.
I have to like dip out, so I don't want to sit there. My youngest has a concert, so I'm gonna give our just update, and then I gotta go to the school and watch the concert. So for those that don't know me, I am Ashley Nelson. I'll stand up. I don't know if anybody faces me. I'm Ashley Nelson. I'm the new Director of Health and Human Services for about like a month and a half. And so I am here today. Kathy had me on the agenda, and I'm not quite sure what Jeremy used to share, just updates on staffing.
Yeah, each of the other departments outside of the ADRC, anything they had there.
Pleased to thank us all for coming to work today.
Yeah.
I'm not gonna do that. All right.
And that was about it.
That's what it's coming to work today. Okay, all right. So updates for Health and Human Services. We were able to hire a third children's long-term support worker. They are not starting until June. They are currently working at a school locally, and so they have accepted the position, but have to wait till the end of the school year. So then we will have 3 CLTS workers. We have a social service worker in the children and family unit also starting in June. They're currently a student graduating in May, and they have accepted a position in our children and family unit doing child abuse investigation. So that will start, they will start in June. With Jeremy leaving and then myself being promoted, Rich Green was also promoted in the children and family unit. He has been a youth justice worker with us since about 2019 maybe. So he has accepted the position of being the supervisor. So he is the new supervisor in children and family services. And that left his position as a worker open. So that is currently running it for recruitment right now. So we do have 1 opening in children and family services that we're looking for a child protection worker. Child support is fully staffed. Our economic support department is fully staffed. CCS is fully staffed. We hired Tracy Forseth recently, and so she is rounding that up with 4 workers in our CCS department. Brenda Jones retired after many years of working for Rusk County Health and Human Services. She was an adult services worker. Alicia Granica, who is in children and family services, made a transition over to adult services. So that is kind of why we have lots of transition in children and family. Right now we are recruiting for a breastfeeding peer counselor in our public health department. That is a recruitment that is actively running right now. Hawkins site manager Kathy, I believe, has been hired, but
Yes, but I don't have a start date yet. She had a baby and she's figuring out how long she needs before she can start.
and then we will be having a recruitment for elder benefit specialist, if that is approved by personnel in May. So, lots of changes in health and human services, but we will get through.
Familiar. Do you want to tell them what's been going on this week a little?
Yeah, okay, so with the fire, at Greenwood Manor. A lot of HHS staff have been helping out. Public health has been amazing. The nurses have been there every single day throughout the night. There are individuals that need, personal care and help with their hygiene. The nurses have been awesome. Chris Soltis from Adult Services has been over there. Carla, I think everybody has basically been over there just offering assistance and helping with meal prep and kind of some planning. We don't know when the Red Cross is going to shut down the shelter at this point in time. We just had a meeting at 11:30. As long as people are in need of the shelter, it is going to be open, but it is not a long-term option. So we are trying to work with each individual on what the plan is to get them out of the shelter and into an alternative living arrangement. It doesn't sound like the apartments are going to be back up for them to live in for quite a while. I'm getting mixed messages, 6 to 8 months. I don't have a time frame. There's no solid information on that yet, but they're sleeping on a cot at the rec center. So obviously that is not ideal. The Lighthouse does have some beds for individuals. So we're working on that as an option for short term, and then family and friends and things like that. So we are trying to work with everybody on getting them out of the shelter. Tomorrow we have many community members, a lot of DHHS staff that are going to go to the rec center, and we're just going to have tables. It's going to be a resource information overload basically for everybody. ADRC, Kathy, I think, and Pawn are both going to be there. Adult Services, economic support. We're going to have a lot of resources available from Human Services there to meet with people from 10 to 4. So everybody it's kind of all hands on deck to help everybody. Other community agencies have been awesome. Food has been donated from several local businesses and churches. Connections has donated clothes. St. Mary's has donated clothes. Everybody has been very, very generous with whatever the needs are out there. So we appreciate everybody helping. But that's kind of my update for the fire.
Yeah, the event tomorrow is actually called the initials are MARC, Multi-Agency Resource Center. And there'll be lots of people there. And I think they expect about 30 clients to come into.
Yeah, so I think they said there was 35 residents, and everybody is invited to come tomorrow as well as their support system. So they are going to have food provided and then all of the resources available and lots of staff to help them.
The best case scenario is that they're able to open up half of the building if the electrical is separate from the damaged part. That would free up part of the building, but the other part's going to be a while.
Yeah, they said there was lots of good water damage. So for that.
Thank you for sharing that. Any questions? I guess you can dip out.
I'm gonna dip out. I gotta go.
Sign in.
Or do you want me to sign you in if you didn't get the paper? Sign yourself in on the.
Right here.
Do you? I can borrow it. Thank you.
Okay. ADRC Advocacy Day. We have 9 people going on the bus up there. They have some tentative times for the bus meeting, having us get the number or the list of people to it, and then she'll send the final what the times are, and then we can set our final times. So I will get that to you guys. He wants it by next week, so then I'm sure after that she'll back what our final stuff is. But the tentative stuff that she had said was similar to last year, like that 6 something in the morning over there. So we'd be leaving here probably like 4:30 is my guess. Oh, and we do still have Fawn then, so she will be one of our drivers, and Angie is coming too, and I'll meet you guys there like normal. Both of you that are going. I did reserve for 10 spots. If there's anybody else that would like to do, I do have 1 more spot that I had reserved. We just have to get you registered, and I think the registration ends. Today, tomorrow, it's soon. Oh, it's gone. But even if it was closed, I know that I could just email Janet since we already had the 1 spot saved. but,
If you have none people you're gonna need me to drive to.
tomorrow. Since I got Angie and Fawn, they both could unless you wanted to, then right now we have, which way do you want to do it, Mark? Do you want to be a driver?
Well, I'm going, but if I were to leave from my house, I could save myself almost an hour
Oh, wow.
because of, round trip, because I wouldn't be coming 23 miles in the opposite direction.
Did you use Bob last year too? Did you take Bob last year?
We had a rider. I had a rider.
Did you come here or did he meet you since he lives in Warehouser?
No, he came, we met here. It doesn't make any difference to me. I mean, it does make a difference, but it's not that important.
Tomorrow is the registration deadline. That's what I was thinking, and it was one of the 2 days. Okay, so that's 2. I mean, we can fit in the county cards.
Well, the Durango. 7 or 8 technically
Because 7 would be, the-
comfortably, I mean, really 5 comfortably, but
Yeah.
I would still say 2 cars.
would you be okay with me getting you Roberts and you 2 connecting and ride that way, and then we could just take one? And go with them that way, or is that
Are you just driving to Eau Claire? So how many people are actually leaving?
7?
7.
Well, 6, I guess.
So the only thing is like the Durango, you have to get in the way back. I mean,
Not that easy as you get older.
as we get older, right? I don't know whether I'm gonna be hopping back there, so I don't,
And you can, but yeah.
I mean, Angie could.
I'll just plan on coming here and meeting people.
Okay. All right, and one of the people that has signed up did have a hospital stay, but she's been texting me, he's still planning on going, so we'll see if she's going to the hospital hopefully by then. Oh. Okay, all right, so that's the updates on that. For ADRC position status, last time we were here, I was telling you we had Michelle and that was all great. And Fawn gets to tell you her own news because, I'm sad.
All right, I have officially accepted a position at Barron County. I am doing the same exact job, an elder benefit specialist there. So my last day here will be May 22nd. Very sad about leaving.
We're sad you're leaving.
That wasn't what I
So we're
fully
sad she's leaving.
wanted to do, but. What am I saying?
She's excited about the opportunity, I'm sure, 'cause-
All I want to say here, yeah, if you want to know how I really feel later.
No. Anyway, so we have the rubric together. Ashley and I have the rubric together to present to personnel. They meet now on the 8th. It got changed today from the 1st to the 8th.
It's gonna be the 8th. We're not sure of the time yet.
Okay, I'll need to know that whenever it comes up. But yeah, so it was the 1st, but now it's the 8th. We cannot recruit until after that, which is, we're grateful to Fawn for her
That's
giving
why
us.
I'm staying as late as I am, because I want to make sure that this position is filled.
And at least will be advertised.
At least advertised.
Maybe closed, maybe not.
Yeah.
So,
But luckily we are, the ADRC of Barron and Rusk County, so I'm hoping still allow me to help out and with our residents here.
so please, if people are saying to you, there's nobody getting back to me from the ADRC, there is no way we're gonna be able to fill in all of Juan's stuff. So we're gonna do it, where it's gonna be a lot of, here, call this number if you have this situation, call this number. And it's gonna be piecemealing as best we can to get it covered until we get somebody in there. And it's a good thing it's not Part D time or we would be. Anyway, so just wanting to let you know that, where that status is at. And again, I'm excited for her, but sad for us. And, okay, so any other questions on that? And then for the next thing is health promotions. It's the one that looks like this. It says 2025 health promotions. Got the green that I passed around. The one side has what Barron is doing. The other side has what Ross County is doing. You'll see it's similar, but a little bit more going on in Barron. They have 3 times the amount of money to pay for these things. We get like less than $3,000 to pay for that out of our aging dollars. So we're doing luckily we have that partnership that they set all this stuff up for us and to come out of that funding. And so that's great. But, so the Eat Smart, Move More, you guys, that one's been around. That one will only last until we get all the codes, because that was ARPA dollars. We bought those. We have 16 of our codes remaining that we use with ARPA dollars. So that's that online virtual one that for helping people learn, have ways to learn how to, exactly what the name says, Eat Smart and Move More. So people who have taken it said it's really great. It's 6 weeks. And then there's the Walk with Ease. Marlene could talk about that one. She did that class. The Walk with Ease is a book, self-directed, and they have times on that is so that she can know when to check in with people and how they're going at it. We have the books in the office. Stepping On, we have a big push this year for Stepping On, trying to get multiples of those, because that is one of the biggest fall prevention programs in Wisconsin, and Wisconsin is one of the highest fall states in the US. And partly because of ice, and who else knows why, maybe they say alcohol. So Lissa is working with EMS and public health and other entities she has a fall prevention coalition that meets after the coalition for public health, so that a lot of the same players can just and work on that with what public health is pushing with their coalition. It's a lot of exercise, using our natural trails, things to keep yourself active. Walking is a huge thing to keep your brain for dementia healthy, and also for keeping you from having falls by getting extra exercise. So having that push across the county, having all the partners that we have at those meetings and the different events that they're running, the library. We look at our Facebook page, it has a link out there for a survey right now around these whole things. And it's all just kind of, what do you need? How can we help you get moving and get all this going so that we can get our county healthy? And I know the hospital is part of that as well. So anyway, so that's that one. We have, you have to have 2 people trained. Kathy Helber has been trained, but we weren't able to get another person trained last year because they canceled the one that was in the fall. And then we tried Kay Searfoss, who used to work at the hospital in nutrition, or a dietitian, right? She has volunteered to do that. I think she's retired now. But the first class they had, it was full. And then, so she was waiting for the next one, but they added another one because there was such a push to try to get it going sooner. So that's why we get set up at the fall. We're getting to do it in July. So she'll be trained, and that will use a good chunk of our at least $600 and possibly more. But hopefully only around $600 of our almost 3,000 for getting her trained, but then we can run the class. Out of that, it's all her time, everything's volunteer, so. And then so Walk with Food Wise, this is new, and it's going to be at the Rusk County Library in Ladysmith. It's not something that we're doing ourselves, but it I don't know a ton about it. When they were talking about it, it was like Walk with Food Wise. It says it's like this whole program similar to ours, but it's a little bit longer in length. All of these have to be evidence-based for us to count them. And so I know that there'll be more information coming out, and I'll be putting it in the source. It's new. And that Tai Chi for Balance is being done by UW Extension, hopefully in the fall. So some more information to come on that when we know more from them.
What is that Tai Chi? Is
Tai
that
Chi, it's a type of yoga.
Oh, okay.
Does that go again?
Yeah. See, I'm glad. I
Please
don't know.
demonstrate.
I'm home. I really am cut off because I can do whatever. You don't see it. Alice, sorry.
The camera's not following the voice. Usually it can follow the voice.
Yeah, what did it be right on me?
Yep.
Yeah.
Yeah, I'm walking out today. I'll take it. Any questions on that? It would be nice for you to see what we're doing that way. I also, since I was at a meeting, I grabbed, our information and assistant specialists are going to be doing the memory screening day here, May 19th. Joe. I mean, it's right at the ADRC, right? Are you, or you're not a screener yet, it's all Angie. She's still getting screen, she can't do memory screens yet, it's a whole. Tricia says it'll be about 6 months of training.
Oh.
So, anyway, Angie will be doing it here, Tricia will be setting up the appointments for her, they're normally 15-minute increments, people in and out. She submits them all out. If they request to the doctors so that they have the status, even if the status says that it's good, we advertise it like it's a blood pressure check. So it's good to know where your brain health is at, just like it is good to know where your blood pressure is at. Then Tricia at our last management meeting gave a new version of what she's doing with living with dementia plan. Is all kind of laid out. Some of the things are removed, some are not. The big thing that's hot right now is this transformational art in Russ County. It's full. And people were quite sad that it was full. And so that's been going really well. And excuse me. She's starting, some of these things are not all in each county, but you can go to either county to get them. And some of them are just done by Tricia coming to go. So I just thought it would be nice for you to see her updated quick version. And if you needed it for like, you wanted it, if you had a customer for the transit or whatever, then you know what we have going on outside of the source. Sorry, I'm getting a cold and ran out of water. I get it. Dry. Any questions on any of those? Okay, so here I'm going to talk about peer place data entry for the ADRC. So with the ADRC, you know what our Sam's Well Sky was like. We've talked about it several times. And it was really, really, really slow, right? So we were hoping to have a new system. We have it. And we talked about this before. It's very clear. At this step, then this step, then you got to do this step, and this step, and this step. It takes longer than the old system. It has more options available to us. And they're not going back, and we can't go back to the old one because they paid for this one. It's interesting. We're still not sure if we're doing it right. The thing that we were worried about is maybe like micromanagement at the state level is starting to happen. They, like we're still trying to figure out how to work this and get our stuff in. And before you had like till the 10th of the next month to get it in, and they're checking, oh, well, you're 2 weeks behind. Where is that? You don't want me to write you up? And we're like, let us figure this out. So anyway, bear with us. We're trying, we're working really hard. That's actually why I don't have some of the staff here today, because I'm like, just get her done so that they don't give Baron a hard time and all that kind of thing. So we're working on that with our peer place data. And I will tell you, I think I told you before, they made us have one champion, and their venue was that go ask your questions of your champion. Well, I'm a champion. And then they have this training, you need to go like this with the mouse, you can't see, and they're done in a half an hour. Okay, have a great day. And I'm supposed to train everybody in each area and different things. And I'm like, we all pushed back and said, that's not possible. We're not champions. We're not the ones in there every day entering in these different areas. So now they've changed that role or that language. We're not champions. We are capable of going in there and deleting the duplicate application. And that's our role, is to do that and email the state for them if there's an issue. So thank goodness for that change in status, because it was like causing problems, because like, how can you be an expert in something that nobody in the state is an expert in? And I sat and I was watching these videos and I'm going, I would go sit with the INA, and I didn't sit with Fawn because hers was supposed to be taught by the state, but didn't really happen. And I sat with our DBS, and we're going, well, let's give this a try. Hope we don't make an error. And then we didn't have the ability to delete yet. So it was really been interesting. But the trainings on the ADRC side for that are kind of slowing down. And then there's just, there's some things that are still not able to be used. And so it's like, I'm sure they'll ramp back up once we have to do that. And eventually our time reporting will go in there. And I'm a little worried about that. I have been all along, because that's part of where like, that's where our drawdown comes from, all of our extra. So we have our regular grant dollars, we have our drawdown from, um, our drawdown from our, Medicaid things. And if it's not, if we don't capture it, and like right now, like if I have a customer, let's say, and I worked with them on a Medicaid app, which that's not on my role, but let's just say that I did, and I would put it in, I'd put the data entry in around that. But then later I'm looking up the data entry on my time reporting, I would put it in, but I wouldn't have to go back into the program like Sam's before and put that in. But now I would have to go in, and it's a subset that they haven't even taught us how to do, how to add it and add more time to that for everything. Or right now, click, 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 click throughout the day, 15 minutes or less, and you have the whole day recorded for what you did for time. That's 15-minute increment time reporting now in a system that you have to click and go to different things. So I'm a little nervous what that will look like. And I hope they don't implement it, but I doubt they won't. So, but it's not supposed to happen until 2026 if they can figure out the bugs. So. And they haven't paid for it yet, so there's a chance that might change, but
Wow.
that was why they wanted this program to have everything together, so.
The goal of this is to track efficiency or?
No, we have to put our stuff into data so that we can see like where people are. And in order to get our drawdown, we have to track our time reporting. Right now, we're still using our old process, which is this sheet, it's in the Excel sheet. Just submit it. They're looking to change that into this other one where we already are doing that now. We have those extra steps to do it, but for the main visit with the person, we're not being told yet that we have to do those extra. They're saying, well, you can play with it and try it if you want when you met with somebody or you did paperwork. So let's say it's a disability application. You met with the person, you were with them for an hour, and then you get their medical records or something like that, right? Then you'd have to go into that last visit you had with them because they weren't with you again, which is on a different date, create a subset underneath it with the new date of how long you worked on something for their case versus checking a box. You see what I'm saying?
Yeah.
So I'm hoping that as people figure out efficiencies with this, that we'll learn it too. But right now it's been a struggle, just being honest. And I don't feel like I'm a ton of help to them. I feel like I'm learning from them because they're the ones doing it every day. And I only do it once in a while and mostly in the INA field. So like the other two, like Fawn is pretty savvy on the computer. So she kind of just figured out and reached out to some of her resources. So I just wanted you to be aware of that. Then, any questions on that? Okay, so the next category is aging. I wanted to talk to you about, training, Pure Place, training for there. They haven't had any on the aging side. Kay has taught herself everything. They do have one coming up in person in June, I believe, in Eau Claire, or July. And then they finally will have a fiscal one. One is in June and one in July. I just don't remember which one is which. I got a lot of meetings coming my way and I don't remember which one is which. But Kay seems to have hers in hand. Hers is, she doesn't have to do like all that time stuff and all that extra things. She did do the checking. And at the WAR level, we have Carrie, who is a guru, who really took the time to learn it. So it's really good to have that resource to be able to do that, even if they haven't done all the trainings. She's been very good to reach out to and get those things. Okay, feel really confident in that. They are going to be changing some things again, which is why they're finally doing the training. And it's going to get a little bit more complicated on that end too, but we'll see how that all works in the end. And hopefully it goes decent enough. Some of the issues that they're seeing on the nutrition side is that we'll have like so we do assessments of people to run a report because we're just able to do reports like 2 weeks ago. And now if people are trying to run the reports and you're getting
60 people from a different county and not your own people. So they're trying to fix all those errors in the transition. So now that that's open, so each phase of the opening is another, what do we do with this? And so all that's. Okay, I just wanted to make sure that the group remembered that even though we had those first dates out there, I had all those errors, I cleaned it all up. If you look at the bottom, these should be all right. If anybody sees it in areas, I give you permission to slap me, but not hard, please. But 1 PM always here on of those dates. We'll start with ADRC, and then if it's the nutrition one, they will always be after. It won't necessarily be this same length because the way that I understand it, since we had to move this one from our normal bi-monthly thing, they have to make a new link. So I'll be adding that when I get it. So, and then anything else from the hospital or anybody else, anything else that you want us to know? Any other updates of things going on that I forgot ADRC wise?
Just so you know, on the advocacy as far as walkers, I did contact the city about the corner of Port Arthur and 27. All the shards and stuff from the accidents all winter had gotten pushed up onto that pedestrian landing.
Okay.
And I thought, well, once grass grows, it's going to even be more dangerous. So, you know, the snowplows and everything just, you know, put it up there. And now that the snow's not there, it's just shards of glass and sheet metal and plastic. And so I did send an email to Doug.
Okay, perfect. Did he respond with thank you, or did he respond?
He didn't, but he usually just takes care of it.
Perfect. Thank you for doing that for advocating for our people.
Well, if you're not walking it, you don't notice it so much.
Right.
But I thought it could be really dangerous if somebody got on a mower
And I
and
started
started hitting that stuff. So I did reach out to them.
very much. That for a quick, that's the difference between Jeremy talking and Ashley, I think.
Oh,
yes.
Half hour.
Anything else? Mark?
Okay, completed the agenda. Is there a motion to adjourn?
That motion.
Second,
I make a motion.
been moved and seconded. All in favor, say aye.
Aye.
Opposed? Motion carries. So let's start the nutrition meeting.
It's just one recording because I only gave you one link.
Okay, the first item on the agenda is approval of the minutes from the previous meeting.
That motion to approve the minutes from our previous meeting.
I'll second it.
Moved and seconded. Any further discussion? All in favor, say aye. Aye. Opposed? Motion carries. Not seeing any public comments, so senior services.
So we had decided a long time ago to leave on their employee status and no changes. So yay.
Yeah.
That we had that on there because there was so many every time for so long. And
There's an advantage of not doing jail meals.
yes, there's the advantage of not doing jail meals and they had raises, right? So that helps attract too. So I'm thankful for that. Outside of the one that she gave about help, Hawkins, I guess that one. So we had that opening in Hawkins. Jess, she's going on to other adventures and she's gonna be processing from her own farm at her home and doing all that. So we're excited for her to be able to go to that venue and build her family business. And so we do have the new person starting after her maternity leave. And I'm sorry, do you remember her name? You were at the interview, that's why I'm staring at you. Oh, I'm sorry, I don't remember her name. You remember? Oh, he doesn't, yeah.
For somebody's name?
So no, so sorry, but she's from Hawkins and she knows the community. She's lived there her whole life. And she's super excited. She used to work for Geldwin and is looking for an opportunity with just having her baby that allows her to work part-time. And she's got lots of family support to make that happen and she's super excited. So yes, I don't, we get to see, when we interview people, we get to see the names for a couple minutes and we have to turn in the sheet. So until I get the paperwork when she's starting, I don't have the name locked in and I'm sorry for that. Cause if she watches this, I don't want her to think I don't care, cause I do.
She's also known in that area and
Yes.
was that some of the older people would come on over and try it out.
Yeah, we hope so. That it seems to make a big difference in communities if they know the person, you know, especially more so in Hawkins and in Sheldon, you know, like if they know somebody or get to know them, then they feel more comfortable, right? Bruce is a little different. Yours different because it's a little bit bigger. Yeah, those
Is there
two.
a policy what, will she be able to take her child to work? I'm just curious because.
I've allowed that
Here.
for drivers, depending on the age of them. And depending on like if they're self-sustaining kind of, but a baby isn't really self-sustaining when you know. So I don't think she'll be able to do that right now. And she wasn't asking to. She said she had lots of coverage. So. But yes, we have allowed that depending, like if they're like 4 or something in your.
I know most of our salaries are, most of our hourly employees don't get paid that much, that if you had to hire child,
Right.
it'd be a strain.
For sure. Yeah, which is why that got opened up or was always, I mean, it was before me. So. Anyway, yeah, so that's the employee status. So any questions on that? Okay, so meal prioritization and contract. Last time when I was here, I talked about how the jail was exploring on a contract service. It would have cost us more to do it that way than the way we're doing it now. Not necessarily them more, but us as a county overall more. Because they weren't gonna cover the home delivered drivers or even our site managers. They were just gonna do the delivery, anything extra, and it put it higher than what we currently have. So it has, they have the meal prioritization stuff. I have to still get out and do the visits with all the people. I keep, it is a high priority on my list. It unfortunately keeps getting moved because of all these other things that have been high priority. And so I will get it done and we'll see where that's sitting. We did close Hawkins on Fridays with Jess going. Talked to Laura about it and I got part of the form done. But I never sent it to them yet, but they did already pre-approve us for doing that. And then we'll know where things are sitting because we know with budget, we have to try to be fiscally responsible. So we're trying to show that we're doing. So that's where we're at. And I want to do that meal prioritization before I talk to those other companies that the state that haven't even made it into the state. And that would be the next thing after. So that's sitting. Other updates, unless you guys have questions on that. Other updates, dining at 5. So I just wanted to brag about that a little bit and give a little update. I am not going down there every time anymore. I used to be coordinating and everything, and I'm not going to be down there every time. Marie Bentley is taking over part of my role down there. She's still learning how to coordinate the volunteers and things that are happening. I'm still doing that, still doing the trainings with them because that's a lot. But she's doing a great job at the serving and talking with the people and those kinds of things. One of the things I feel like the ADRC needs to do without, like when I'm there, when I'm talking to the people, I come back with at least 5 or 6 different asks for our staff every time. And I disseminate, this one wants this one wants this, and then I just have my little note and I hand it out to the different people and then they go and they help them right away. So that's something that's, Marie doesn't know any of that stuff, so they're not getting that aspect that they will used to get every month. Unless we're down there, although last month I was there because I had 3 new volunteers to train and, I had, but not all of them showed, so. And also, we had the registration for, the Efficacy Day. So, but the big thing is we have waiting lists. So that's the thing that I wanted to brag about. We've been having waiting lists and it's a little sad because everybody wants to go, but we have waiting lists and we get 60 people every month at that. So I'm really excited about those numbers and that staying up there. And then, the next thing is insure, and I should say other updates, so I'll still let you guys, that too, but with insure, when in March, we had to raise the price because the price was raised of the insure. And then in April, we had to raise it again because we couldn't get in the one kind of bottle at all. And, we don't have any budget to absorb because we do it right at cost to people. So, we had to match what, if we had to get the higher expensive bottle, if it's not available, because we tried waiting for the other one, they were in desperate needs. Over, sometimes over $10 difference with the prices we can get it for to $7, depending on the kind. And if it's a specialty one, it'd be even more, less by doing it because we're not taking anything for helping. And that's a huge bill on families having insured to make sure the person is not malnourished. So, we did raise that. And if anybody says, why did they do that so quickly? We did try to, in the source, I just put, due to cost increase and unavailability, kind of left it really generic. Thought about putting.
Insure at the hospital.
Or
Is there any way that it's any cheaper by buying it?
I don't know. I don't know. We don't have lots of it. Like over the main place where they would keep it. We had a program in Arizona where we would give away cases of insure. And if patients came into the hospital and they were malnourished, they could come and pick up cases of insure. But she was asking if we get it at a better price. I don't know. I can find out.
on the second page of the source, you'll see our price and that's right at cost.
Okay.
Anyway, so I just wanted you guys to be aware in case there's anybody that's like, why are they doing this so quickly? That's why. No choice.
Is there any way of working directly with the company?
We are working directly.
You are.
We are working directly with the company. We're even have a hard time getting it all, which is why we had to go to the more bottle to try to get that. And then that's still not a guarantee we'll get it because sometimes we were waiting a month for a particular flavor. And like we were down to just strawberry for a while.
Did something happen at one of their production facilities?
Good question. I asked Kay kind of the same thing and they just said they aren't able to keep it all in stock with the command. So I just don't think it's a production loss. I just don't think they have it increased to meet the demand is my guess, but I don't really know.
Is there a homemade formula that's comparable to Ancher?
I know that we have to be really cognizant of how much of a ruckus we make because different counties have been shut down to not be able to do it with the companies by their rep. I did do my 3 years ago and told them that we're not doing it only through the meals program and our rep didn't shut us down, but like Barron got shut down when they got checked on. I don't want to not have it at all, so I don't want to toss too anyway.
Right. I'm just,
so.
if this whole supply chain thing really gets to be an issue, we may have to become really creative at how to accomplish the end goal of nutrition without having some of the other avenues. So I was just thinking, we may have to come up with making some sort of an adult cup.
Well,
other counties, when they couldn't do it this way, they said, okay, it's at Walmart, but that's a higher cost, so it's.
Right.
And so as long as we can keep it, we're gonna try to. I'm trying to tell you.
But, you know, we've become so, you know, adapted just going, picking up. That may not be true in the future.
Right.
So, you know, we may have to start thinking about lines of getting something done without the usual product.
Right.
You know how much you provide?
Say again,
Do you know how much you provide? In,
how many go out? I know when she orders it, she's gotta order 30 cases at a time. And I know she's been ordering 2 to 3 times a month, so. And that's just to try to get it in, and then it's gone as fast as we can get it practically, so. I think if we could get it faster, that's what it, I don't know that exact number, no. I just know how much she orders and it's have a minimum order.
Question, why can't they order more at one time?
Truck space and cost, and they expire in a certain amount, and it was always, and you can't, if you get too high, then you don't get any. The number is, Kate says it's kind of not fun ordering. Cause you've gotta try to get it in there, and then it looks like it's there, and then you submit it, and then, oh, it's declined because they didn't have enough of that product or whatever. So she would be better to answer this because she takes care of it all the time, but yeah. And so if I'm not accurate in my stuff, I'm sure Kate can correct me really quickly, but it sounds like quite the ordeal. At times, and other times it's easy peasy, but right now it's not easy peasy. So. It definitely seems to be a high need. Any other questions about insurance? Just in any other updates that anybody wanted to bring about nutrition? We will be having our Independence Relay. I know that's not necessarily nutrition, but it will be June this year. It's normally in May, but it's not until June, and I'm still working on the final dates. We got it down to 2 dates. I just gotta get a chance to call Jump River. And
So the next meeting date for the nutrition
until August.
committee is August 21.
We only do them 4 times a year.
We've completed the agenda. Is there a motion to adjourn?
Motion to adjourn.
There's a second. And seconded. Favor say aye.
Aye.
We're adjourned.
That has to be a record.